In this episode of our Clinical Series podcast, we will be discussing the importance of getting a shingles vaccine in protecting us from painful outbreaks. Why is it important to get vaccinated? Shingles is a painful viral infection caused by varicella zoster virus, the same virus that causes chickenpox. After recovering from chickenpox, the virus can remain dormant in the body and can reactivate years later, causing shingles. This reactivation usually occurs due to a weakened immune system, stress, or aging. Shingles typically manifests as a painful rash that develops into blisters, usually on one side of the body. It can be accompanied by symptoms such as fever, headache, and fatigue. Getting vaccinated against shingles is crucial for several reasons. Firstly, it helps prevent the development of shingles itself. By receiving the vaccine, your body is introduced to a weakened form of the varicella zoster virus, which stimulates your immune system to produce antibodies that can fight against the virus. This means that if you come into contact with the virus in the future, your body will be better equipped to prevent shingles outbreak or reduce its severity. Secondly, getting vaccinated against shingles can significantly reduce the risk of developing post-herpetic neuralgia or PHN. PHN is a common complication of shingles and refers to persistent pain that can last for months or even years after the rash has healed. By preventing shingles, through vaccination, you are also lower the likelihood of experiencing this debilitating condition. The shingles vaccine that is widely recommended is Shingrix. Shingrix vaccine is a non-live vaccine that contains a protein found in varicella zoster virus known as glycoprotein E. This protein helps stimulate a strong immune response in the body without actually causing the disease. The vaccine is administered as 2 doses, with the second dose given 2 to 6 months after the first period. It has been proven that the vaccine to be highly effective in preventing shingles and its complications. Clinical trials have shown that it reduces the risk of shingles by more than 90% in individuals aged 50 and older. It has also been found to be effective in preventing PHN in those who still develop shingles despite being vaccinated. Due to its effectiveness, Shingrix is now the preferred vaccine for preventing shingles. What are the common side effects of the shingles vaccine? Like any vaccine, the shingles vaccine can cause side effects. However, most side effects are mild and temporary, resulting within a few days. The most common side effects of shingles vaccine include pain, redness, or swelling at the injection site. Some individuals may also experience muscle pain, tiredness, had a fever, or an upset stomach. The side effects are typically as saying that your immune system is responding to the vaccine and building protection against shingles. It is important to note that serious side effects are rare, but if you're experiencing any severe persistent symptoms after receiving the vaccine, it is recommended to consult your healthcare provider. Can you still get the shingles after being vaccinated? While the shingles vaccine is highly effective in preventing shingles, it is still possible to develop the condition even after being vaccinated. However, the vaccine significantly reduces the severity and duration of the illness. Studies have shown that individuals who still get shingles, despite being vaccinated, experience milder symptoms, and have a lower risk of developing complications such as PHN. It is important to understand that the shingles vaccine does not provide 100% protection against the virus. However, it is still advisable to get vaccinated as it can greatly reduce the risk of shingles and its associated complications. If you do develop shingles after being vaccinated, it is recommended to seek medical attention promptly to receive appropriate treatment and minimize the impact of the illness. Who should get the shingles vaccine? The shingles vaccine is recommended for individuals aged 50 and older, even if they have had shingles before. This is because the risk of developing shingles and its complications increases with age. Additionally, individuals who have a weakened immune system due to certain medical conditions or medication that should also consider getting vaccinated. It is important to know that individuals who have previously received the older shingles vaccine called Zostavax should still receive the newer Shingrix vaccine because it is more effective, and provide long-lasting protection against shingles. When is the best time to get the shingles vaccine? The best time to get the shingles vaccines is when you are in good health and not currently experiencing an outbreak of shingles. It is recommended to get vaccinated as you turn 50 or as soon as it is available to you. Remember that the vaccine is administered in 2 doses, with the second dose given 2 to 6 months after the first. If you are unsure about the timing, or have specific health concerns, it is always best to consult with your healthcare provider. How do we manage reaction to the shingles vaccine? As mentioned earlier, side effects of shingles vaccine are usually mild and temporary. If you're experiencing pain or discomfort at the injection site, applying a cold compress can help alleviate the symptoms. Over-the-counter pain relievers such as acetaminophen or ibuprofen may also be taken if recommended by your healthcare provider. If you have a concern about potential side effects or reaction to the shingles vaccine, it is important to discuss them with your healthcare provider before receiving the vaccine. They can provide guidance specific to your situation and address any questions or concerns you may have. Thank you for listening to the podcast.